Hi everyone, my name is Dr. David Kulla with Synergy Wellness in New York City. Today we're going to discuss trigeminal neuralgia. Well, trigeminal neuralgia is something this young woman has. Trigeminal neuralgia is a neurological condition that causes chronic facial pain. The cause of trigeminal neuralgia is a blood vessel pressing on a trigeminal nerve in the head, in this region here. And the trigeminal nerve is more commonly irritated after the age of 40 typically. The condition is characterized by pain coming from the trigeminal nerve, which starts near the top of the ear and splits in three. And you have the ophthalmic branch that goes here, maxillary branch that goes across the cheek, and the mandibular branch across the jaw here. And we have two trigeminal nerves for each side of the face. Oftentimes, trigeminal neuralgia most commonly affects just one side at a time, thankfully, because it's very uncomfortable. It can mimic a lot of different things that can be confusing for people. So, trigeminal neuralgia also occurs spontaneously. It comes out of the blue, but it's sometimes associated with facial trauma or dental procedures like fillings or root canals. And maybe a few other types of procedures I'm forgetting about right now. So the condition may be caused by, again, a blood vessel pressing against the nerve, the trigeminal nerve, also known as vascular compression. But there are other things that can cause trigeminal neuralgia, like bruxism and TMJ problems or jaw problems. That can trigger it as well. And when you grind your teeth all night long and you have a misalignment in your jaw, that can make you more susceptible to having tense muscles, and that can cause tension and spasm and inflammation, and that can trigger also the trigeminal nerve because it's in that region. Also, another cause can be a concussive trauma to the head, neck, or upper back, that causes injury to the nerve pathways in the spinal cord or the brain stem, and this would cause trigeminal neuralgia as well. So after cervical trauma, facial pain can be triggered immediately, or, which is tricky, it can occur months or even years later after the injury. So to treat trigeminal neuralgia, your medical doctor usually will prescribe medications to lessen or block the pain or the nerve signals to the brain. And they usually use anticonvulsants like Tegretol or Carbatrol, and there's a few others out there. It's been shown to be effective in treating the condition for some. Now, remember, all medications have side effects and should not be taken for more than 2 to 3 months, especially if you're not seeing any results. Another option is treating the condition with cold laser therapy. And that's what we've been doing here with Priscilla. And we've been able to, she just developed trigeminal neuralgia recently, about 5 days ago. We've treated her daily for 5 days. How are you feeling now?
Much better.
Much better. Okay, great. So she's already doing better. She's luckily not getting the pain into the tooth. She's getting more of a quick, spontaneous prick, like somebody sticking a needle in her cheek. So with this MR5 Active Pro laser, I know exactly where to go and laser the areas. Now, some of you at home may have home lasers, and you can use your home laser at 1,000 hertz if you have that. They all range, they're all different, but you can use that to reduce the inflammation right around the nerve root, because the trigeminal nerve does come to the surface. So it wraps right up here over the ear. So you would want to do it right at the top or in front of the ear here where your sideburn is, and then go right down and go right in front of your ear, and then go down here along the jaw, the mandible. Then you're going to come up here and you're going to go right there on the cheekbone. And you can even do another spot if it's bad on the front where your sinus is, right here, slightly in towards the nose from the cheekbone. Okay, and lastly, if you're having pain around the eye, you can go up here, right up where the temple is, right up here, a little bit higher, and that way you're reaching every branch of the trigeminal nerve. And then also we would have you go right here behind the ear and under the skull, pointing the laser kind of upward into the brain stem. Again, this is going to calm all the inflammation down in the trigeminal nerve. Now, something I want to mention, a lot of people get this confused with dental problems. So they think that they have a tooth problem. And when it gets painful enough, it feels deep enough that it's a tooth issue. So we've actually had patients have not one, not two, we've had a few with two teeth pulled, but 3 teeth pulled. And we've had in some of the situations the dentists say, listen, there's nothing wrong with your tooth, but if you want me to pull it, I can. And people are so desperate that they actually have it pulled. So before you do that, if your dentist tells you there's nothing wrong with your tooth, trust him. If you want, get another opinion, but trust those opinions. And you may have trigeminal neuralgia. If you have neck pain, neck stiffness, and you're prone to headaches as well, then these are all signs that you probably have trigeminal neuralgia. And there are things like MRIs and tests that you can do. If you guys have any questions or comments about trigeminal neuralgia and how to treat it, cold laser therapy, hands down, is the best way to treat this. There are no side effects to this, and it's extremely effective for any type of neuralgia or nerve pain. Thanks for tuning in, and if you learned anything from this video, please hit that thumbs up button. Make sure you subscribe. We've got 4 videos that come out every week. I appreciate you for tuning in. See you soon.